President of International Institute of Health, Safety, Environment. Today, we will welcome the very effective man in Africa to making great job about health and safety issues. And we will discuss about their global projects as a president of OSHA Africa. So welcome, Ehi. We are very happy to welcoming you on our a project that we are affecting the youngers to show the success of the great leaders. Thank you very much for joining.
Thank you, my very pleasure. Thanks for inviting.
Yeah, thank you. And I want to mention that this project is about the people who want to improve themselves on this profession, on the future. For example, the youngers and the students on our profession. So we want to show that our great leaders doing great jobs, and we want to show the projects of these international institutes, companies, and also individuals on this way. So I want to ask firstly, can you please introduce yourself to our audience?
Thank you so much. I am an occupational health and safety management consultant. I work as the CEO in Occupational Managers in Lagos, Nigeria, and I am I hold a qualification I hold in my doctoral in workplace health and wellness promotion. So this is what it is. I've worked for over 23 years. I'm getting old, so my best.
Yeah, great. Great. You are doing great. And I want to also show that your website is oshafrica.africa, so everyone can take a look at the website to know more about your organization. That's great. We are very happy to welcoming you to this organizations, these interviews. So I want to also know about your motivation. How did you start this profession? What happened? Can you explain the situation?
This is a question to answer. Yeah. My first degree, my first master, occupational health was never a list of what I had to do. I finished school and I found myself working in a hospital as a healthcare and working for oil and company become component project for them. This company will train you and to the level they are. A number of people must give the responsibility because so I volunteered that I should be given the role to what they do, and that was how I was given the role of that project. And this project was for Shell Petroleum Development Company. And the moment I was given that role, the very first training I ever had in health and safety was given to me by Shell. So I'm very happy that that little training they gave to me that year was what inspired me. I realized that a lot that I can do, there are a lot of new things I had to learn, and I was so inspired. So after the lecture, every new word I saw, I wrote it down. I went back home, I started putting the word on Google and started finding out what does this word mean. So that was how I grew. I understand more about occupational safety. And I just told myself, this could put food on my table in the future. So I gave it all my best shot. And today, the rest is history.
Yeah. And also, I want to ask you, what do you personally think should be done globally to improve the future of health, safety, environment? Because You are the potential leaders for these issues on the globally.
I think what we should, which of course, I think what we should do has been done, but we have not followed up. I'll tell you how.
Uh-huh.
What we should do, which
Uh-huh.
has been done, the Global OSH meeting in Helsinki.
Yeah.
That meant to put talk about global OSH coalition, bringing everybody together to be able to work together, in one accord. But we had that meeting, and there has never been any follow-up. So after that meeting, everybody went into slumber, everybody went to sit down, and nothing is being discussed along those lines anymore. So I think the outcome of that coalition that was in Helsinki to take out those things that we discussed.
Mm-hmm.
Let's be. It doesn't mean whether you are in Africa, you are in Asia, you are in Europe. The problems are the same. Let's begin to come as global OSH leaders, begin to look at issues the way they are, and let's come together. No region, no country has the solution. But able to get reasonable solution. Bring everybody together. Let's start discussing this thing and let ILO champion this cause. Let ILO take the lead and WHO, because you know that right now it's no longer only about safety. It's also about health and well-being of employees. Let these two global bodies, global agencies, United Nations, take the lead. Let's start discussing issues. As we have issues that will be discussed and it's getting better, coming up. It doesn't matter whether this concerns us in Europe or it doesn't concern us in Asia. Nobody is safe in the world until everyone is safe. And this should be our slogan, and we keep making discussion to ensure that we make these things happen.
Great. Also, I want to mention that these interviews will be present on YouTube on English, but also you can have a chance to watch this video with subtitles with about 70 language. You can read the items, so what we are talking. So this is a good chance for the humanity to follow the great leaders around the world. So also we will open a website to see these interviews and also the biographies and also future plans. We will highly motivated to work together around the world, and you will see our next steps on the websites. So I also mentioned that we having a chance to take the questions from the visitors, from the audience, so they can ask the questions themselves to us on these interviews. Please write your question on the platforms from YouTube and LinkedIn. So I will ask also your questions after my questions finished. So the last question, the next question is coming for what are the projects that OSH Africa plans to do globally in the near future?
Okay, since it was said, and projects keep coming based on the new we are seeing in the workplace. One of such projects we have done, we saw the need to enhance or improve the competencies of OSH and labor inspectors in Africa, because we found out that whether it is Kenya, whether it is Nigeria, it is Malawi, it is South Africa, the problems were the same. So what we did was we realized that government of each country, Ministry of Labor of each country just employ people in the name of occupational safety inspectors or labor inspectors, but they don't have the requisite training that they need to do their job effectively. So what we saw that as a general concern. What we did was to see how we could partner Workplaces Without Borders in Canada, and we designed what you call the African OSH and Labor Inspectors Training. And this is one project we have done. We have trained over 100 and something inspectors from over 21 African countries. And this has improved the skills and the competencies of us and labor inspectors across the countries where they attended. Then again, we also realize that research is also a key issue. What we have done in Osh Africa through a scientific committee on Osh data and publication is to see how we can train people in the research. We have professors in those departments. Because you do not up, you can't profile solutions. We need to know the problems. When we know the problems, we're able to think of the solutions. So what we are doing with that right now, we are able to train people in the I mean, now African writing papers and their papers are this is one thing we are happy about and we see ourselves doing. But again, what we're looking, we are going forward to now in the visa to bring occupational safety or training into university. Schools do not have occupational safety and health within their training. And someone doing on level has never gone through a course in occupational health and safety. He's graduating and going to the workforce. So what we're doing right now is develop views that can be into the curriculum so that we are prepared to be able to understand what occupational health and safety before they graduate. What do is this? It will reduce the state of, it will help people to the workplace. What are those we need to do? What are those things we need to learn? What are those things we need to be aware of before we move to the workplace? So this is one of the projects we are doing. We are on right now. We are taking to the future, and it's going to be a continuous project within the place of Osh Africa.
Do you have any project about, I mean, overseas, for example, with Asia countries? Do you have got any contact with them?
In where?
With Asia's countries, I mean. Do you have got Asian any contact with? Yeah,
Asian countries.
Yeah. Asian, yeah.
We have partners. Funny enough, now we have partners virtually everywhere in the world. We have partners in Singapore, we have partners in Malaysia, everywhere. Even right now, we have a project we are also doing called African Asbestos Awareness and Prevention Program.
Yeah.
Asbestos in Africa to it. So it's up. Creating education awareness. I mean, seeing how resource exposure is limited. Yeah. People that want to handle asbestos, they know the harm that asbestos comes with, and they're able to come in with appropriate protection. Most houses that have been built in Africa were built with asbestos. Those houses are getting old right now. They're going to be demolished. The people that are going to demolish it, what are the protective equipment? And those that live in those environments where those houses are going to be demolished. When you demolish those the doors that go into the sky, they're all full of live around those neighborhoods. How do we manage these processes? Yeah. So this is something that we're also taking into the future right now, creating awareness and education and seeing how we can reduce the state of asbestos exposure within our region.
Very important issue. And I want to ask this question because I saw you everywhere. You are very active, man, about doing your best for Africa. So that's great. And I believe that we have got too much potential to work together on future. The last time I saw you that you are participating in ENETOSH, the European Educational Network. So that's great. You are doing your best, and we appreciate it. And congratulations for the future.
Thank you.
Yeah. For the next question is about civil prevention. What would you recommend to young people who take you as their guide to do in the field of civil prevention? I mean, what's your advice about starting this profession? About studying, about starting which type of companies or associations they need to be volunteer. So we need to understand how can they manage their um, steps for being a leader like you?
Okay, what I mentor a whole lot of people in Nigeria and across Africa. And one thing I have done, one thing I keep doing is telling this young man the way. There's no name any be the way it is. It might be like it, but if they're able to take it and absorb it, it will make them better. I tell younger professionals, if you are looking for a place to make quick money, Osh is not that place to make that quick money. Most of us that come into Osh field, we didn't come in because we wanted to make money. We came in because we wanted to create value. And that value is driving us earlier on, 3 years in the I'm rich man. But think I will just come into Osh and just make money. No, it doesn't happen that way. Again, I also advise people, advocate, Osh should Osh generalists. We have enough people in as analysts who Osh management specialize. We should start specializing. We need more specialists to be able to prosecute the issues that are coming up within the Osh domain. Osh has so many domains. We have occupational hygiene. We have, but everybody gathered these days. Everybody has become Osh trainer. We have enough Osh trainer people to start specializing. I mean, when COVID-19 came, we realized how much the world was short of Osh hygiene. How much the world was running short of occupational hygienists. We knew the value of occupational hygiene when the COVID came. Yet Africa as a continent, we hardly hear people talk about occupational hygiene. The professionals, the experts in occupational hygiene in Africa, the number is so minute. But when you talk about Osh training, you have a lot of people, and this is what I'm advocating. We need to move out of that space what we call ourselves. Oh, we are Osh health and safety experts, health and safety practitioners. What is your field of specialty? When I need is a professional tomorrow in a specialized field, who do I have? That is the point. That's the point we should start making as well. We're giving to people within Africa. I see every day people are migrating. Last year I was available to speak at the Nigeria Nigeria Society for Industrial Hygienists, and I saw people moving to this field right now, and I'm happy. So the area means we need people to move to the area of health. The domains are just too large. We need people to take a small area. Workplace mental health is a field. If that's what you want to practice, stay in that area. Workplace health assessment, occupational surveillance. If that's what you want to do, stay in those areas. So we need specialization to come in as quickly as possible. It will change the face. The people that say, okay, we are occupational safety consultants. What is your area of specialty? We want to hear. And this is the dimension we are taking it.
Yeah, 10,000 people around the world in yearly basis, especially youngest people, is connecting with me, as I believe that also they are connecting with you. Can you promise the younger about helping them on their connect with you? How can they connect with you for these issues? Can you explain your connection abilities? So I want you to promise us to helping them after any connection, because I believe the motivation of connection is so important for future.
For me, I have no other life. This is what I do. So active on LinkedIn. Follow me on LinkedIn. Just for the name Ehi Iden. Ehi Iden, you see me on LinkedIn. Ehi Iden, you see me on Twitter. I mean, you might see me on Twitter as Ehi_Iden. That's why I am on Twitter. On Instagram, you will see me. On Facebook, you will see me.
Everywhere.
We need to connect because I mean, everybody is talking about digitalization right now.
Yeah.
We need this. There's a project I just within Africa, setting up what you call HSE, Creative Center. And we need to make this happen. The solution in organizational safety is not practitioners. We need to open it up. It's too multi-dimensional. Let's bring people in from different professions. We need the help of IT professionals, those that can write applications, those that can design software. We need to bring them in, and that's why we're setting up that all Occupational Health and Safety Creative Center in Lagos. We will make it open for everybody, so that from agriculture, give us the processes to safety in agriculture, create the solutions, the prototype we need to design applications that can help prevent S&S within agriculture. We are bringing in IT experts into occupational safety because it will be easier for me if I can have an application in my hand that I can use to do inspection at a flash of finger. I can use I'm doing inspection and plotting into the application. It's converting into report, generating report for me. So when this happens, the truth is that it becomes a partnership or intercourse between occupational safety professionals and the IT creative experts. So what they have done is to help us, things that we used to do as manual assignments, they are able to help us break it down into digital platform whereby it makes the work easy. It makes turnaround time easy. You finish your inspection. As you are finishing your inspection, everything already be keyed into your application. It generates report for you immediately. So you see, instead of us waiting, those that we went to inspect have to wait for 2 weeks for us to send manually write report and send to them. That report comes in the next day or a day or a minute after. They're able to see that report early enough, and intervention comes quickly, and closure becomes more easy. So these are some of the things we're doing, and we just that we're able to implement this, flag up this in 2024 in Lagos.
Yeah, great. And also the other question, I think there is maybe a connection problem on LinkedIn, but you can watch also these videos on YouTube in the same time in live. So the other question is about what is the global problems of health and safety environment professionals?
I think one of the problems is that one of the I see most professionals are eager to get the work done.
Mm-hmm.
Sometimes they don't have that government support to I want to run. So we have that lacuna or inertia or inaction that comes from government. Mm-hmm. In most countries, even the laws are outdated. In some countries, there are even no occupational and safety laws for use to work. And government has become, gradually across many countries have become an impediment to the growth of occupational health and safety. In some countries in Africa, as a clear example, you have inspection you have done and you see violation and you put an infraction there and maybe you seal up the place. Then somebody from government goes to open the place up without asking you why was the reason why you sealed that place. And 3 weeks after, there's a disaster, accident happened, people's children, people's parents die because what you saw that made you to seal the place as an authorized thing. The people that went to open the place did not ask you how they went behind you and opened the place. Then 2 weeks after, what we were trying to prevent people, the government, and all you hear is that we are on there to look at what we bring all the people. So these are some of the challenges that occupational health and safety professionals are having. We need laws, legislations to be updated. Fast change, most of outdated legislations. What are the legislations put it by that, even in Nigeria, as a clear example, the mental health policy, national mental health policy we're using, you see some things referred to as lunacy. Because lunacy is no longer a word that is used in mental health. It was drawn from the lunacy ordinance that was put in place by the colonial masters. How can a law was put in place in 1950 be relevant in the age that we are in? So, to be up, and these are all the issues that we are challenging.
Yeah. Yeah. And also, I want to mention that our participants, our viewers, can also ask their questions, and they can also share their ideas on your answers. And I want to also ask some questions about what do you think about the people, the professionals doing on their jobs when we make some projects to improve the safety culture on workplace, but we don't make anything about the public part of the people. I mean, in home, in public space, we don't make anything to improve the safety culture. Do you think just only make safety projects about safety culture in workplace is enough to improve the mentality?
I like what that is an issue I have been talking about lately. I think we have to look into this and see how we can change the narrative.
Yeah.
What we are doing right now,
yeah,
looks like training workers for own workplaces. Mind you, studies have said that workers spend the highest number of their wake hours in their workplaces, no doubt. But a worker does not live in only the workplace. A worker has a part of it that's in the workplace. A worker has a part of it that's in his family, in his homes. So what I advocate for, what I teach here in Nigeria, I always say, by you employ a person, you have employed that person's family. And why do I say so? Whatsoever you do to the person in the workplace positively or adversely affects his family. The more reason why we must be along in the issue of health and safety concerning employers. A clear example is when COVID came. When COVID came, what are we with that workers? The workers knew to go out and feed. But a family member going out without nose mask. How do we workers it was to tweak our system, what you approach of integration of safety in our culture.
Yeah.
And that's the point you are bringing up. The culture should not be what just need to transcend to the whole family employee. Yeah. Talking about work of the employee will not be affected by workplace or by how he's managed in the workplace. Relationship with also implemented, but most times we don't look at that. We don't look at it when we are making plans. We don't look at it. What we should be doing when the employee is employed, the left hand to drive is the only way that we can improve safety so that the employee is safe and the employee's family is safe. If the employees has been trained to be safe in the workplace, when he gets home, the home is not safe. What happens? So there must be an integration between the culture that we practice within the workplace and also seeing how we can drag the family, how we can also help the family to be aware of what safety means, so that so that employees don't come to the office and feel protected and get soap and feel that he's vulnerable. And this is the point.
Yeah, I think this is a big issue because I saw that not too much education, but some of them yes, but not too much education is trying to affect the family of their workers, doing nothing about the other part of our life, because we are not in a simulation that take place only in workplace. We also living in different public space, so we also making a motivation and a vision for individuals to think about more about safety and health and environment. So if we do something for the youngest people, I mean about the preschool students, we will change the safety culture of the countries with this type of projects that we are doing. We have got some projects. Yeah, I
Let me show
explained
you
something. Uh-huh.
what you just said
Sorry.
right. What you just said right now. There's something that I must give credit to the government of Zambia. Okay, Zambia has flagged off that project. Zambia has flagged off that project under the Vision Zero program in Zambia. They have what you call SWOT, Safe Workers Tomorrow. I love that project. It's such a good one. Safe Workers SWOT. Taking the concept of Vision Zero, primary schools and secondary schools, and setting up what you call safety clubs, safety societies, safety association. So what they're doing is that they believe as a child is growing, that child needs to understand what safety and health means. Once the child is able to get this right at elementary education level, it grows with the child. Children that we are seeing today in different schools are the presidents of tomorrow, that understand health and safety in school by virtue of the SWOT program as launched by the government of Zambia. That child becomes a president tomorrow. He remembers, I was taught this while I was in elementary S and S. He's able to bring it back. So what they're doing is that they're being new leaders for safety and health in the future. And I think this is something that every country should emulate and see how we can bring this discourse into the school, into the elementary school curriculum.
Great. As I see that you have got patience to do something for public, I want to invite you to our project that I will explain now. We are focusing to make some trainings to preschool and high school students before from the preschool to high school level. So we will make some trainings created by some professions to educate the youngs about safety culture, environment culture, and health culture. So we will also make some maps about risks. They will go around the map. They will go around the location and solve the different risks on the roads, and they will come face to face and solve the risks, and they will finish the map, and we will make a prize. We will make some congratulations to the youngs. So this is one of the project. The other one is about making competition for the youngs to solve the public safety problems. The best one who is giving the evidence of the resolution of the risks on their public area, I mean on home, on school, on markets, for example, they will send evidence to our mail address, and we will make the best of the year about risk hunters. So we want to collaborate with the associations like you about these projects. So we want to do these projects around the world in the same time. I mean, you can start with a spot school or spot location with us in your countries, so we can use these projects solutions with the press, with the TV channels and other platforms, so we can open a new door for public to make something on these issues.
It sounds a very great idea to us. It boils down to what I will be saying. Nigeria is a studies in school. I give you a clear example. You teach a child how to wash hands, because to go too much, one thing, one goal at a time, and implement that goal. And observe and you go to use the washroom, come out, you must wash, before you eat, you must wash your hand. Before you do this, see, that alone a long way in helping. It came back to influence the entire video, and the child said, "No, mommy, I was told that you need to listen to the child and support the child, because that's a more superior argument." So the child was taught in school, but that child came back home and influenced the members of the family. And so this is the point or one or goal objective, and we say this is what we want to achieve for the next 6 months. We drive it through, and we see the impact it's creating. I think it's a very novel project. I think I want to be a part of. That, you know, anytime.
I am so happy to hearing that. That's a great answer to me. I think also Turkish people is very excited. And one question is coming from our audience. Have you ever been to Turkey, and have you ever had HSE work? He said.
Okay, I saw that question earlier on. I've been to Turkey several attended conferences. I think conferences is I think TIOSH or so conferences in Turkey twice. I mean, I've been there twice, but I haven't really moved beyond the perimeter of the conference. I mean, to see what it really looks like in the workplace. I would have really loved to see that maybe in one of those, which of course is a recommendation, one of those conferences, if we can have what you call technical tour. Technical tour, what that means that we can actually have vehicles that move some of us to the workplace to see how the work is done, because we need to see the processes really and see how it is done. So I haven't been to a workplace in Turkey, but for Turkey as a city, I've been to Istanbul 2-3 times now, and I think it's a place I love to come back to.
Yeah, great. And Gulafer Zar said this is very nice and efficient conversation. She wants to see the future you in Turkey also. She's inviting you. Yeah, I am also inviting you for our next project.
When you want to come, I'll come.
Yeah, we will organize some conferences, and you will be one of the first individual or organization leader on these conferences. That's true. Yeah. So I see that everything is okay, and question is asked. So if you want to share anything about your organization, about any type of things, there's a good chance for you. Please explain your ideas to us, and then we will close these meetings. And I want to say that that's great to welcoming you on this event, because you are the best, one of the best choice to invite. We are very happy, and we are believing that you will do great jobs for the humanity and the future of global world of health and safety environments. We believe and we are highly motivated to work with you on these issues. So yes, that's what you want to tell, and we will finish.
This is closing notes, and I speak this with passion from my heart, because I think this is something that we need to start connecting as occupational health and safety professionals. We need to start in the health, safety, and well-being of workers in their workplace and to their retirement.
Yeah.
We see safety issues. Oh, there's a call, there's an accident, there's an instant repercussion when you violate safety rule.
Yeah.
But when you violate the rules that belong to health and well-being, you don't get instant repercussion. It's not like when you have accident, oh, they cut his hand, there's blood on the floor. You may not see blood on the floor, but a person's life, health, and well-being is being destroyed, and the impact is so cumulative. You will not see the effect right now. You don't see it as at an acute level. You see it at a chronic stage, and most of these manifestations happen about 10 years or even that job entirely. Yeah. While we go back to our work, let's remember life after work. If we must have life after work, then it is a moral responsibility and our duty to employee, but said within this well-being lies issues that have to do with mental health, and a lot of exposures that will happen in the workplace. People taking a lot of chemical exposure, you don't see it as an accident, but the chemical goes in, destroy very vital organs in their body, and they manage to work for that period of work life. But when they retire, the impact of these things are beginning to show. And we also have people who have been badly managed. They fell into a wrong workplace or managed by a manager that was not trained on how to safely manage people. So they work under 5 years of their entire career. Have what load, all manner of body, prevalence of work burden and fatigue that were not addressed while they were working. But remember, these people are going to retire someday. The things that we didn't fix, we didn't look into, we didn't see as important while they were working with us, become things that haunt them after they retire. But the good thing is that a good workplace leader, honest leader, will lead his workers not just to retire, but to retire and have an active retirement life. Because the things that accumulate in them today that we didn't address will ruin their life at retirement. And at the end of the day, what you pay them while they are leaving your service at retirement becomes the money you give to them to look for health that you ruined while they were working with you. So this is something I think you take home as a food for thought. Remember, while you work today, tomorrow comes where retirement is. And if you don't take care of yourself today, what you neglected today becomes what haunts you tomorrow. And this should be our thoughts to our workplaces. Thank you very much.
Thank you very much. Also, I want to give some info about something that we are doing in our profession. Our job is very, very different from the other jobs, the other professions, because we have to be a volunteer on the daily life. When we solve something, when we solve a safety problem on any lamp on the street, we have to have a responsibility to report this issue to the government or other organizations, because the other professions cannot have any responsibilities. But I believe that we are automatically having responsibility these issues on the daily life. So our professions is not start on the workplace and will never end in workplace. So I am inviting all the people to be being a member of OSH Africa, and all the IOSH, RRSM, and HSE, and the other associations in your countries. I am inviting you to being a member of these associations, because you must be a member of these associations as a volunteer on your profession, to improve our profession, improve our country's safety level, safety culture. So the last sentences is coming for invitation to the individuals, to our professions, to being a member of our organizations. Thank you very much for your attention and participation. That's a great chance to us to discuss for future responsibility, future possibilities, future how can I say, future chance to making collaboration. And I want to thank to all the audience, all the viewers to participate in this event. So the next week we will welcome Sky Boulevard from Australia, and we'll continue. We will watch together, I believe, these interviews. And after the leader of the associations, we will invite the companies leaders, presidents of the companies, and the influencers on our profession, and we will go on all the year, all the next year. So thank you very much, and have a nice night.
Thank you.
Yeah, thank you.